My name is Dr. Christina Kramer. I am one of 3 obstetricians and gynecologists here at Cuyuna Regional Medical Center. I am a board-certified obstetrician and gynecologist, and I've been practicing here at CRMC for the past 4.5 years. I am a native Minnesotan. I grew up in Maple Plain, Minnesota. I went to medical school at the University of Minnesota, Twin Cities, and then went out to Buffalo, New York for my residency training, and then moved back home to start practice here at CRMC. So painful intercourse, or the medical term for that is dyspareunia, is a very common condition among women in all age groups. We acknowledge in our practice that it's a very personal and sometimes difficult topic to bring up to a provider, and that it may take a patient or a woman a while to bring that up and feel comfortable discussing that with her provider. So I think the most important thing that I bring when I encounter patients with this condition is just trying to create an environment where they feel comfortable talking about something that's so personal. And this can happen to women in all age groups, and depending on the patient's age and the history that comes out, we're thinking of different things that may be at play, whether there's an infection, whether there's some sort of mass, a tumor, whether benign or malignant, whether there may be something like pelvic organ prolapse contributing, or there could be musculoskeletal problems. So those are all things that I'm thinking of as I talk to a patient and do her exam. I often tell patients that this is not necessarily a condition that we have a quick solution for, and it may take a couple office visits for the patient and I to build a rapport and work through different treatment options. But it's a very important condition for a patient's quality of life, and it's a very gratifying condition for me as a clinician to treat, to give women sort of their lives back. And so I think the most important thing I could communicate to a patient is that it's not quote-unquote normal, and although it may be an uncomfortable topic for a patient to discuss, we're happy to discuss that with you and try to make it as comfortable a process as possible. Treatment options are really dictated based on what the condition is that we think is causing the painful intercourse. You can have something as large as perhaps needing a surgery if there's something like a large ovarian cyst or a large fibroid on the uterus, and it can be as easy as treating something like a chronic yeast infection or vaginal infection. For women in the perimenopausal transition or who have gone through menopause, there's a lot of hormonal changes that can have an impact on the patient's body and may also lead to painful intercourse. A common condition that we see is something called genitourinary syndrome of menopause, which basically refers to vaginal dryness due to those changing hormones. And I like to talk to my patients about all the different options that are out there, including over-the-counter remedies, as well as prescription medications that may help treat that condition. It's a very common complaint that I hear patients say to me is, I thought this was just my new normal, but that's not necessarily the case. So I guess my biggest plea to patients is if this is something that's bothersome to you, please come in and talk to us, because that's not a normal part of aging per se. And some of our treatments are as easy as one office visit and a prescription. We work with our physical therapy colleagues, and sometimes we have also psychologists or sex therapists who are all also very important members of the team, and we're all on the same team to help you feel better.